as a diagnostic biomarker. So we are trying to just go through the presentation and try to highlight what are the possible implications of saliva in the future of disease diagnostics, what are the difficulties that can be encountered during it, and what are the possible uh, markers that can be evaluated in various diseases of the oral and systemic illnesses. Now, to begin with, over a period of time, that the laboratory investigations of blood or serum has been established as a gold standard in order to identify various disease-based biomarkers in order to come to a specific diagnosis, be it in terms of diabetes or in terms of any kind of metabolic disorders or malignancies of any part of the body or oral cancer. Serum or blood always had the advantage of being diagnosed primarily because the technique that were available were easily identified components of the that are found in the blood. Some of the difficulties that were faced when we use serum or plasma is that it is kind of invasive, wherein you need uh, to use a syringe to obtain the blood. There is a possibility of cross-infection when it comes to using blood, and the difficulties that may probably be encountered when using blood is that it is difficult to repeat the test over a period of time, considering that now the most of the diagnostics are involved in personalized medicine and the use of continuous follow-up of various patients. It is necessary that we do a repeated test, and in such case, the use of serum was probably having some kind of difficulty. Hence, it is always possible that various other fluid-based vehicles could be used to identify these biomarkers. Something like saliva, urine, and CSF were employed at various stages. Saliva is primarily important because has advantage of being non-invasive mode of collection, is easy to collect, and there is not much expertise required to collect saliva. Since 1960s, lots of research have been done to try to use saliva as a diagnostic fluid for identification of various biomarkers. However, it did not really come to a specific conclusion primarily because of various problems that were involved by in using saliva. Some of them included the lack of uniformity in collection of saliva. So whether the saliva should be collected in the morning, whether it should be collected in the evening, whether it should be pre-runs. So those were not clearly described. There was no proper criteria on when to collect saliva. And most of the components found in saliva are usually found in minimal concentrations as compared to blood. You may not be able to see it in higher concentrations, because of which you need a more sensitive and specific technologies or a sophisticated instrumentation to identify these biomarkers even when present in small quantities. And of course, there is not much knowledge available on what are the components of saliva and from where these components come into saliva. Hence, because of this, the possibility of using saliva as a biomarker did not really push through, but in the past few decades, it was found that saliva could be a useful biomarker primarily because of the advancements in the technologies which are available to detect various components of saliva even when present in small quantities. And more or less, these components in the saliva are found to be amenable for identification as much as effective as being in blood because of the technological development. In addition to that, saliva being a non-invasive and easy method of collection had an advantage over blood. It also, when it comes to oral lesions, the close proximity to the oral lesions helped in it's beneficial to identify salivary-based biomarkers. And of course, this is the vast majority of various components which are inherent component of saliva itself, or which can come to the saliva via plasma through diffusion and ultrafiltration, that can be identified using the various technologies. And finally, the possibility of repeating the test over and over again in terms of modifying the treatment protocol or modifying or management of various diseases has made saliva as a more attractive tool for diagnosis. In short, saliva is considered to be the mirror of body's health. As quoted by Mendel et al. In 1990, saliva may lack the drama of blood, it may lack the sincerity of sweat, or it may lack the emotion of tears. But because of its multi-constituent nature, having lots of organic and inorganic components characterized by the presence of a multitude of proteins and carbohydrates and other components. It has become a very important fluid for oral and other systemic disease diagnostics. The components which are present in the saliva could either be inherent within the saliva itself, which need not be found in the blood, or it can be derived from the blood via ultrafiltration from plasma. The various functions of saliva, as it is always known, is that it is helps in lubrication. It has an antibacterial effect. It has various functions that will probably help in identifying the disease because of the presence of these components. So there are reports which have indicated that saliva can be used as a diagnostic tool in various oral diseases. I've highlighted one or two primarily just to give an overview. Oral cancer is something which is really an important disease, especially in developing countries like India, where oral cancer occurs secondary to exogenous habits like tobacco and alcohol. The use of saliva as a diagnostic tool plays an important role because oral cancer need not always occur on itself. In some cases, it occurs from various precancerous diseases such as leukoplakia, and hence the use of saliva as a diagnostic tool into a precancer may probably play an important role in early diagnostics as well as in modulating the treatment and also to determine the prognosis of oral cancer. In addition to oral cancer, cancers of distant site like breast cancer and cervical cancer has specific biomarkers which can be found within the saliva and which can be helpful in identifying, especially when it comes to breast cancer and the difficulties it encountered in doing the routine mammography or in cervical cancer. This is possible. The use of saliva as a specific biomarker to identify the disease-specific biomarkers can be useful in various cancers of distant site. Microbial infections such as HIV can be useful, can be identified. Of course, it is not really seen the progress as much how we see in cancer. Some autoimmune diseases like Sjogren's syndrome, and for routine drug monitoring as well as hormone monitoring, especially in athletes when they need to monitor their hormones and drugs, the use of saliva as a diagnostic tool has a great potential. So which brings us to the concept of salivary diagnostics, which what is basically required in any diseases right now, whether it is oral disease or a disease of any other nature, it is that we try to identify the disease early. Because most of the time, the problem that is encountered with disease is that they're usually identified at a later stage, and hence, whenever we try to implement an appropriate management strategy, it is usually delayed in terms of identification or diagnosis, because of which the appropriate treatment cannot be given. So we need to try and identify a disease-specific molecular biomarkers, which could help in early diagnosis and appropriate management. And some of these biomarkers, such as inflammatory biomarkers, tumor-specific, genomic or metabolic biomarkers, either in tissue or body fluid, could serve as a potential tool. And saliva being home for majority of these components. And as I mentioned, that because we have great advancements in the technology where even micromolar concentrations of any compound can be identified in saliva, salivary diagnostics has found its way in disease diagnosis. Now, what does saliva actually provide us? The source of information is found in saliva are mainly derived from the DNA, RNA, and the proteins. The salivary DNA will represent the genetic information of the host, the microbiota, as well as the infecting viruses. The RNA provides information on the transcription rates of the various host genes as well as those of the oral microbiome. Protein of the saliva represents the genetic information and help to understand the translational regulations of the host body and the oral microbiota. In addition to these, saliva may also have other compounds such as non-organic compounds, cell cycle markers, various growth factors, cell surface markers, microRNAs, as well as oxidant and antioxidant. These are just some of the compounds that can be used in certain diseases where we exactly know what is a possible marker that is required to be identified. It becomes easier for us to identify that marker. But in certain cases, a single biomarker identification may not really help us in disease diagnostic. We need to probably use a panel of biomarkers, just like a immunohistochemical analysis. A panel of biomarkers probably will help us in directing us towards a more appropriate diagnosis and treatment planning. Now, because of these identification of molecular targets, especially in cancer cells, where we know that there is lots of molecular alteration that takes place, has led to the revolution of a group of disease diagnostics called as omics. Omics is just a term which is used to indicate an identification of a combination of compound, rather a single biomarker. So the omics basically involves genomics, it involves proteomics, it involves metabolomics, transcriptomics, as well as microbiomics. So just to briefly go tell about what these are, I will not be able to highlight all the possible compounds that are identified. The salivary genomic basically indicates the identifying the genetic message and the resulting protein sequencing that is seen in various individuals. Once we are able to identify the genomic sequencing using various high-tech technologies like next-gen sequencing, we will be able to find out variations as a single nucleotide polymorphism that can probably differ from patient to patient, and that may help not only in disease diagnostics but also in providing a personalized treatment for each individual. As we all know that this single nucleotide polymorphism variation is less than 1% in the individual. So identifying of this can give rise to a personalized medicine and targeted therapy directed towards each on the individual. The next possible role of saliva is the identification of salivary proteomics. Proteomics is one of the most important component of identification, especially in cancers, because protein alterations are widely encountered in various cancers, especially in oral cancer. The proteome that is found usually represents the complete set of proteins encoded by the genome. So to identify the protein, we can see that the changes that take place at the cellular level, as well as the post-translational modifications of these proteins can be seen. And this has actually been widely employed in a day-to-day practice, primarily because of presence of highly sensitive techniques such as mass spectrometry, liquid chromatography, as well as NMR spectroscopy, which helps in identification of the presence of a those molecules which are found in very low quantities, even in a micromolar concentration, can be identified effectively, and that can be compared with bioinformatic tool to find out which particular molecule is found, and thereby help in forming a panel of a biomarker for disease for every disease. The transcriptomics basically studies the expression of messenger RNA, and hence a large panel of messenger RNA can be identified using microarray technology, which can further be validated by using the real-time polymerase chain reaction techniques. So these are the benefits of having a high therapeutic. Now, one component of biomarker identification is metabolomics. I'm slightly touching on metabolomics because that is part of my research project. So metabolomics is very significant primarily because they represent the phenotypic change that takes place in any individual. While the changes that take place at DNA is characterized by genomics, RNA is characterized by transcriptomics, proteins are proteomics. They all are more or less indicating the genotypic changes that take place in every individual, which may or may not manifest into a clinical disease or a clinical pathology. But the metabolomics helps in identification of various metabolites, and these metabolites are actually an end product of various changes that takes place in the DNA or an RNA, and hence they are as close as possible to the phenotypic change that is evident in any kind of malignancies uh, or other tumors as well. Hence, the characteristics of metabolomics involved that they help in rapidly analyzing the samples with little sample preparation. They help in assessment of a broad range of endogenous and exogenous metabolites. And as I told previously, metabolome is the final downstream product of transcription translation. Thereby, they appear as close as possible to a phenotype change. Some of the target molecules which we can identify using metabolomics involve altered protein metabolism. It involves oxidative stress metabolites, lipid metabolism, carbohydrate metabolism, nucleotide metabiosynthesis, as well as sphingolipid metabolism. Of this, it has been found that the protein metabolism is highly altered. Of course, there is difficulty in trying to identify these metabolites and differentiate them as per the various cancers, if it is oral cancer and or if it is a cancer of other sites, there is an overlap in the type of metabolite that is usually seen. But of course, we need to try to quantify and identify a specific biomarker, thereby helping in cancer. Now, what do we do with all of these various biomarkers that are found? Since we are now still at a level of a laboratory-based diagnostics, where we need to run to the laboratory and you have a time frame for the laboratory technique to come. So I am probably contradicting what I've said till now, that although laboratory diagnostics are useful, they may have the possibility of lack of expertise, especially when you're using a liquid chromatography, mass spectrometry. You need to have that expertise to use it. It may probably take some time. And nowadays, there is a requirement to probably diagnose and provide a diagnosis as early as possible. And that's where the point of care testing comes into picture, which is basically a medical testing which is conducted outside of a laboratory at another site of patient care, including the patient bedside, or the clinic, or the patient home. So what the point of care diagnosis basically do is to screen and identify a biomarker, which can be associated with the disease prognosis as well as predict the therapeutic response. So it's a two-step process, where in the first step, we need to use a laboratory-based diagnostics to identify a disease-specific biomarker. And once a disease-specific biomarker have been identified, quantified, and characterized, the next step will probably be to try to either to use a handheld device or a point-of-care device, which will provide us with a real-time diagnosis of the disease at a shared site, which will probably help us in modulating the treatment option. So the point of care testing, especially when it comes to identity using blood or whether it's coming with saliva, is basically characterized together as a liquid biopsy, which will probably help us in identifying nucleic acid, protein, metabolites, as well as exosome. And these compounds, when they're taken from the circulation fluid, can then be put into a microfluidic lab on a chip technology and help in diagnosis. The advantages of using a point of care testing are it provides timely information to medical team, they facilitate rational time critical decisions, and they improve the patient outcome in critical care setting. So it helps in trying to repeatedly perform the things like how to do a sugar level estimation at a repeated level. It's easier because we have the technique, and also it helps in some of the costs associated with sampling, handling, packaging, tracking, and also prevents contamination and losing of the treatment. But of course, these will be really helpful only if I can tell that there are specific biomarkers for specific diseases. So point of care devices are basically based on two techniques. One is a lateral flow assay, another one is a microfluidics or a lab on a chip. So basically the lab on a chip process integrates the processing steps such as sampling preparation and detection, as well as data analysis in one small device. That probably helps in identifying a multitude of biomarkers, but which can be probably provide us a direction in what the disease is or what the patient is going to go through. So I'm giving a brief outlook of various clinical applications of point of care, especially related to oral cancer or oral diseases. We have an oral fluid nanosensor test, which helps in identifying multiple salivary proteins and nucleic acid. Onc Alert is a point of care testing device which is used to identify a protein called a CD44, which is a cancer stem cell marker and probably helps in the early diagnosis of oral cancer. We have salivary HPV DNA testing. We have centralized ORA-tech technique, which can probably be used for identifying a potentially malignant lesion. mRNA markers can be used in using point of care testing, especially interleukin 8 and SA. So the thing is, when it comes to conclude, what I would probably say is that saliva is definitely a very important fluid for disease use identification of various disease-based biomarkers. There is a high level of accuracy with regard to use of saliva. Primarily, not people may have a doubt on whether it is on par with serum because of the possibility of low volume of the compound found in saliva. But what it has been found that every time we do not actually use saliva to be compared with serum, saliva has the potential to be a stand-alone tool to identify various disease-specific markers. It has to be substantiated and quantified, however, but they do have, and there is certain times that, especially with oral diseases, the saliva can serve as an tool to identify certain biomarkers which may not be seen in the blood, or which may probably be affected by any systemic illnesses. And the need is to actually establish salivary diagnostics as an independent clinical aid. We try to evaluate and analyze the diagnostic, therapeutic, and the prognostic utility of individual salivary biomarkers, which is very important to us to do it, because unless we do that, we'll not know what test to be done when. And of course, there is a high introduction of robust and sensitive techniques. And what we need to do is basically to quantify and validate and later see to it that they measure for into clinical use. So there is a lot of studies which are done for the detection of salivary-based biomarkers. Of course, they need the validation through the use of prospective clinical study design. And advanced technologies have enabled the identification of a large pool of biomarkers from minimum sample with minimum sample preparation, even when present in small quantities. As mentioned previously, the presence of microfluidics and oral-based diagnostics enables to detect various oral diseases and also monitor other conditions. So salivary biomarkers may hold promise in disease diagnosis, monitoring the disease progression, facilitate intelligent individualized treatment, and also improve patient standard of living and safety. So I thank you for your hearing, and I'm open to any questions from the delegates. Thank you.
Thank you, Dr. Gokul, for your presentation. Any question?